I want to welcome you to this module on oxygen administration. I'm Jean Howell, and I will be your facilitator for this learning. I want to give recognition and our thanks to AgeWell of Minneapolis for the help that they have given us in preparing the videos for this module. The objectives for this module will be to understand reasons a client would need oxygen therapy. 2, to briefly describe the principles of an oxygen concentrator. 3, know the steps needed to fill portable oxygen from a cylinder of liquid oxygen. And last, state 4 safety measures in oxygen administration. This is a picture of an oxygen canister and an oxygen concentrator. Some part of the canister or concentrator will be green. The green designates oxygen use. If you're in a facility like a nursing home or a hospital, there's often a wall outlet to plug this concentrator into, and that plug will be green. And just as a point of reference, air outlets in such a facility will be yellow and suctioning outlets will be white, but green is identified with oxygen. Oxygen therapy is a common therapy for people who have respiratory disorders, such as emphysema, COPD, and asthma. Oxygen is prescribed by the physician to reduce and ideally to eliminate the signs and symptoms of hypoxemia, which is simply insufficient oxygen of the blood, and to prevent tissue hypoxia. In most situations, oxygen must be given in precise amounts. Too much may cause toxic effects, and too little may cause irreversible tissue damage. The goal of oxygen therapy is to give the lowest, most effective dose of oxygen while avoiding the toxic effects of oxygen. Oxygen is considered a medication, and residents who use oxygen will have a written order from their doctor, and this order will specify the type of oxygen to be used. Will it be humidified or non-humidified? Will it be compressed oxygen or liquid oxygen? The liter flow, how much the person gets per minute, will be specified. And the method of administration. Will the person use a nasal cannula or will they wear a mask? And the last thing that will be specified is the time to use it. Will it be at bedtime? Will they wear it intermittently during the day, or will they use it continuously? Because oxygen is not stored in the body, it must be administered continuously when acute hypoxia is present. The tissue oxygen needs must be met at all times. Oxygen administration is never interrupted. Sudden withdrawal of oxygen may lead to more severe hypoxia and result in serious, possibly life-threatening cardiovascular and cerebral hypoxic effects. Simply said, it may severely reduce oxygen flow to the heart and the brain. Intermittent use of oxygen is often of questionable value. Random doses of oxygen do not maintain the constant physiologic oxygen requirement of the body. Intermittent oxygen therapy may, however, be reused for the relief of chest pain or other cardiopulmonary symptoms. It may also be used for the treatment of exercise-induced hypoxemia. People with chronic lung disease may maintain marginally satisfactory oxygen saturation while at rest or while performing mild activities of daily living. However, with exercise, they may not be able to maintain an adequate level of oxygen saturation. Administration of intermittent supplemental oxygen allows this person to exercise. A few examples of signs or symptoms of people who need oxygen therapy could be tachycardia. This is a rapid heartbeat. Number 2, cardiac arrhythmias. They may have an increased respiratory rate and increase in the work of actual breathing. There may be breathlessness, being short of breath, kind of an air hunger. You may see signs of confusion, hallucinations, restlessness. This is all not getting enough oxygen to the brain. And cyanosis, which is kind of a bluish tinge to your fingertips, your lips, and your toes. Red blood cells carry oxygen to all organs of our body. Those of us with healthy lungs have an oxygen saturation rate of anywhere from 96 to 100% just breathing regular room air. Lung diseases can lower saturation rates to under 95%. One way we can measure how much oxygen that is in the blood is by clipping a simple device on the finger called an oximeter, which digitally reads the percentage of saturated oxygen at a given moment. I have had clients whose saturation rates, or SATs, were in the 80s range, and as soon as oxygen was given, the saturation rate climbed to the high 90s. I'm guessing that many of you have already had experience taking O2 SATs of a client, but for those of you who haven't, just know that there are different types of sensor probes. There are clips for fingers and earlobes, wraps that go around toes or across the nose, but the one that you're most likely to use will be the finger clip. Clip sensors should be placed on a finger, not the thumb. Also, it should be placed on the finger of the arm or side that is not edematous. That is, if a woman has had a mastectomy to her right breast, place the probe on the left forefinger. If there is an IV in the left arm, place the probe on the right finger. And if there is an automatic blood pressure cuff on the left arm, you would use the right forefinger. There are a number of advantages to pulse oximetry. It is more cost and time efficient than drawing blood for analysis. It's non-invasive. Minute-to-minute changes in saturation can be assessed and timely intervention delivered to meet the client's needs. And the client's response to treatment can be evaluated immediately and ongoing. In one of the opening slides, I mentioned that the doctor will prescribe the type of oxygen to be used, whether it be humidified or non-humidified. Oxygen is a dry gas, and this can cause irritation and damage to mucous membranes of both the mouth and the nose. Humidification of oxygen is used to prevent irritation and encrusting of the airways and to maintain an optimal environment for the normal function of the cilia, the little tiny minute hairs in the nose that act like filters during breathing. Humidification is the addition of water vapor to a dry gas. The addition of water vapor reduces the drying effect of oxygen on the mucous membranes, making the administration of oxygen more comfortable. Oxygen is bubbled through water, which allows the molecules of oxygen to pick up the molecules of water vapor. If humidification for oxygen is ordered, a small disposable humidifier is placed between the flow meter and the cannula tubing. Humidification of low-flow oxygen through the nasal cannula is not considered essential and is contraindicated because it supports bacterial growth. I liken it to a lot of leaves in your front yard. If the wind is blowing strong, the leaves are going to get moved down the block. But if there is no wind, those leaves are going to stay in your yard and accumulate. The same as it is with bacteria growing in the nose. Most of the residents who you will be caring for in your facilities will probably use a nasal cannula for the delivery of oxygen. The cannula is used for a liter flow of 6 liters per minute or less. The cannula is well tolerated by most people. You simply place the little nasal prongs in the nose, and then you fit the cannula tubing around the ears and adjust the tubing slide under the chin. You always want to monitor for pressure around the ears and pad that cannula tubing for comfort if it's indicated. And encourage nose care regularly in addition to oral hydration. Don't forget, oxygen is a dry gas. Another way to deliver oxygen is through a face mask. The face mask is used when the flow rate is higher, over 6 liters per minute. It's important to have a well-fitting mask, and that's to prevent the oxygen from escaping around the eyes of the nose. About 75% of inspired volume is room air drawn in through side holes in the mask, so the concentration of oxygen is difficult to estimate. Masks today are used more in hospitals and long-term care settings, and a lot of people are afraid of them because of the fear of suffocating. When I was a little girl, I visited my grandfather in the hospital who had severe asthma, and I can remember him being in an oxygen tent, and this was like a plastic cage that kind of fit over his head and his chest, really down to about his waist, where massive doses of oxygen were infused into this tent so he could breathe more comfortably. The tubing for the cannula or face mask can be connected to various sources of stored oxygen. The oxygen may be stored through the oxygen concentrator. There may be a tank of liquid oxygen or compressed oxygen. They might connect to a portable tank that they take with them when they're away from their home or apartment. And they may use an e-tank, which we will describe later. Next, we're going to show you a video on how to apply the cannula and face mask using the concentrator as the source of oxygen. This is an oxygen concentrator. It's an electrical piece of equipment, plugs into the wall, and what it does, it draws in room air, removes the nitrogen, and so we get a concentration of oxygen. So our model today is going to show us how to apply a nasal cannula and a mask. First, we plug the tubing into the concentrator. And then turn on the switch or the machine and set the oxygen flow rate. This machine and most concentrators are set anywhere between 1 and 6 liters per minute. And for our demonstration purposes, we're going to set it at 2 liters per minute. Next, we want to make sure that the oxygen is flowing through the tubing. And it looks like it's a go. So we're going to insert the prongs into the nose, wrap the tubing around the tips of the ears or the tops of the ears, and then pull the little clamp securely under your chin just so it's comfortable. Now, if we're going to switch from a cannula to a mask, we would take off the cannula, disconnect it from the concentrator, and attach the mask in the same way as we attach the cannula, and apply the mask. And again, we want it to be secure but comfortable. And that is how to use a concentrator. An oxygen concentrator is a device that provides oxygen therapy to a person at a minimally to substantially higher concentration than is available in ambient air. I love that word ambient. It simply means the air surrounding you. They are used as a safer, less expensive, and more convenient alternative to tanks of compressed oxygen. An oxygen concentrator delivers continuous or pulsed flows of processed ambient air at various liters per minute. Basically, the concentrator pulls air from the room, takes out the nitrogen in the air, and condenses or concentrates the air so it contains a higher percentage of oxygen. For instance, at 3 liters per minute, a unit can provide a continuous supply of oxygen at concentrations around 33%, and at an increased rate, say 6 liters per minute, the concentration goes up to 45%. There are small portable oxygen concentrators that produce less than 1 liter per minute of oxygen and use some version of either pulse flow or demand flow to deliver oxygen only when the person is inhaling. These portable concentrators typically plug into a wall outlet like the larger, heavier stationary concentrators. Historically, the demand for pulse flow concentrators have not been used for nocturnal use or for sleeping. If the nasal cannula moves such that the concentrator is not able to detect when the patient or the person is inhaling, it is unable to deliver the pulse of oxygen while the person is inhaling. Next, we'll have a video clip showing our nurse filling a very small portable oxygen tank from the oxygen concentrator. Plus, I have stated some safety tips to be mindful of when you're working with oxygen. Before we show you how to fill a portable tank from a concentrator, I want to remind you of a few of the safety precautions when using oxygen. You'd need to wash your hands before handling equipment. I don't think it's necessary to use gloves. Remember, there's no smoking within 6 feet of oxygen. That would be important when you're away from the building and you might not realize that it's a no smoking area. There is no use of combustibles or electrical appliances or equipment in an oxygen environment. And you never want to use petroleum jelly around the nose or the mouth. Make sure that the tubing is not twisted or kinked. And as our model showed before, we want to make sure that you can feel oxygen flowing through the tubing before applying the cannula or the mask. Obviously, we need to set the meter dose correctly. And it's a good idea in an apartment or a home to locate fire extinguishers and the oxygen meter turn-off valve. Now, this small canister can be filled off of the concentrator. You attach the valve from the canister onto the valve of the concentrator and press down. Just a word, it takes a little longer to fill this than it does off of a liquid system. So if you're going to go out and use this portable tank, be sure you give it enough time to be filled so you'll have the usage you need when away from the building. Once it's filled, a green light will turn on the machine. That will be your indication that the small canister is filled. Okay, now we're pretending that it is filled, and we will remove that from the main valve. And then the liter dose setting is a sleeve at the top that you can twist to the correct setting. This nice little canister comes in a little canvas bag with like a shoulder strap. So now you're good to go, and you've got a couple hours of oxygen anywhere you go. Oxygen is stored in two different ways. Oxygen can be compressed and stored in cylinders under several thousands of pounds of pressure. Compressed oxygen for medical use is stored in silvery aluminum cylinders with dome-shaped tops of green. Oxygen becomes a liquid when its temperature reaches about 300 degrees Fahrenheit below zero. At this temperature, it takes up 1/10 of the space of compressed oxygen. The most commonly used form is liquid oxygen. If a person uses liquid oxygen, an oxygen company or provider will set up one or more liquid oxygen reservoirs or cylinders in the home, and they will schedule regular visits to fill these reservoirs. A person using oxygen can have the tubing connected directly to the reservoir, or a small portable oxygen tank can be filled from the large cylinder, thus allowing the person to have several hours of continuous oxygen while he is ambulatory or away from his apartment or home. Generally, a person will use the portable tank during the day and then connect to the large cylinder for nighttime use. Another storage container for liquid oxygen is what we call the E-tank or emergency tank. This is a smaller tank than the regular one in the home or apartment, but it is larger than a portable unit that you would carry. Generally, this tank is embraced in kind of a carrying device with wheels on it, so you can just pull this oxygen tank wherever you go. Here now is a video showing you this piece of equipment, the E-tank.
This is another type of oxygen system that is available. It's often called an E-tank or a torpedo tank, and often it is used in a person's home when they have a liquid system, and if the liquid system runs out, this can act as a backup in case that happens. Or if someone has a concentrator system and their power goes out, obviously they won't be getting any oxygen. So in that case, they can use an E-tank to supplement their oxygen until their electricity turns back on.
I'm going to go through the steps necessary for refilling a portable oxygen tank off of the large cylinder or reservoir. But before you begin, remember to connect the oxygen tubing to the stationary tank in the resident's room. And be sure the valve is turned on, as this will allow the resident to continue to receive oxygen. You will have an opportunity to demonstrate this skill to your nurse. So I will go through the steps now. Number 1, wipe the filling connectors on both the portable unit and the stationary reservoir with a clean, lint-free cloth. These fittings must be dry. Moisture could cause the units to freeze together. Turn the flow control knob on the portable unit off. Remember that while you're filling this portable tank, the resident will be connected to the main cylinder or reservoir. Number 3, attach the portable unit to the stationary reservoir at the filling connectors. You'll want to center the portable unit connector over the reservoir connector. Then you lower the unit into the shaped recess or onto the connector. Once the unit is resting on the connector, hold down firmly until the filling process is complete. Number 4, open the fill valve. This valve is found on the portable unit. Press the fill button. This will start the filling process. As the unit is filling, you will hear a hissing noise. When the unit is full, the hissing noise will change and you will see a small cloud of white vapor at the connection. Always remain with the units while you are filling. The fill time for a portable tank is approximately 2 minutes. You may work in a facility that has a special separate room for filling oxygen. This is a safety feature. But whether you're allowed to do it in the client's apartment or home or in your facility, there's a special room. Always remain with the equipment while you are filling it. Number 5, when the unit is full, slowly close the fill valve. Disengage the portable unit from the stationary reservoir. If the unit does not separate easily, don't force it. The units may be frozen together. Wait until the units warm up and they will separate easily. Do not touch any of the frosted parts of the connectors. Liquid oxygen can cause frostbite to the skin. Number 7, the last step, reattach the oxygen tubing to the oxygen outlet on the portable unit. Remember to turn the oxygen back on for the resident at the correct liter flow. And if you have any questions about it, be sure that you ask your nurse. And lastly, wash your hands when finished handling the equipment. Now we'll show you a video putting all of these steps together with Vicki, our nurse.
A portable tank off of a liquid system. On the bottom of the portable tank is a round circle, and on the top of the liquid system is a valve that you will connect to each other like a puzzle piece and press down. Now for demonstration purposes, I will not be completely filling this portable, but I want to show you what we do. We pull down the lever and it will make a noise. And if we were completely filling this tank, you would eventually see vapor coming out much like a smoky mist, and you would actually hear a sound change as the tank was getting fuller. So we pull down the lever. And now, sometimes it gets stuck onto the tank, and there is a white button on the top of the liquid system that we can press to release the portable. To check the volume and how full this portable is, there's a strap. And as we zoom in here, we can see that this tank is now about 1/3 full. If it were full, the green would go all the way up to the top. and it would be heavier. Now, many tanks are different, but the principles are the same. Usually there is a strap that you would hang on to that would show the volume of the tank. And be very careful to not touch the bottom of this tank or the top port of this liquid system, as it's much like sticking your tongue on a frozen pole in the playground, and that hurts. So that is how you fill a portable tank. And you should get about 4 hours on 2 liters with this system.
Here now are some safety measures to be mindful of when using oxygen. Remember to wash your hands before handling the equipment. No smoking signs are no longer used in many facilities which are fully sprinkled and are non-smoking buildings. But buildings which allow smoking must post a sign, and there be no smoking within 6 feet of the oxygen equipment. There must be no smoking or use of combustibles, spark-producing appliances, or equipment in an oxygen-enriched environment. Even garments that are made of synthetics or wool may generate sparks of static electricity. Friction-type or battery-operated toys and devices should be removed from the immediate environment. Remove all volatile or flammable materials. That would include alcohol, oils, and petroleum products. Move them to a safe place. Do not use petroleum jelly or Vaseline products around or in the nose, as it is combustible and not absorbed by the body and difficult to clear from the mucosa. Make sure you can feel the oxygen flowing through the tubing before applying the cannula or the mask to the resident. Set the liter dose correctly. Be sure that the tubing is not twisted or kinked. And make sure that there is no furniture, wheelchair, or walker pressing on the tubing. Be sure that the tubing is not tangled around the person's feet or in any way when they're walking. Obviously, this is for fall prevention. If a resident with oxygen goes outside to smoke or is with someone who is smoking, remember their clothing is saturated with oxygen for 15 minutes after their oxygen is discontinued. It's a good safety precaution to locate fire extinguishers and oxygen meter turn-off lever or switch. Be sure that you keep the oxygen container in a secure, upright position. Tubing is changed when oxygen is not flowing well, and some protocols state to change the tubing weekly. You follow what your site recommends. The nasal cannula can be washed regularly with warm, soapy water and rinsed well. Here is a summary of principles for safe oxygen administration. Number 1, oxygen is a drug. It has both beneficial as well as undesirable effects. 2, oxygen is a dry gas. Humidification is necessary for nasal prong devices when the flow rate is greater than 4 liters per minute. Always observe for oral and nasal irritation and maintain good oral hydration for your resident. Number 3, oxygen supports combustion, so no smoking, open flames, electrical appliances which could produce sparks. Number 4, oxygen cannot be stored in the body, so you never remove an oxygen source from a person receiving continuous therapy. Portable units help maintain independence and mobility. I want to thank you for your attention today. If you have any questions about the content of the module, please ask your supervisor. Now, when you are ready, you may take the assessment. An oxygen administration skills demonstration will be scheduled with your nurse.